Welcome, respected healthcare providers. Before we commence, let's take a moment to center ourselves. Please find a comfortable seated position in a tranquil environment and allow your body to relax as much as it is possible for you in this moment. Visualize yourself in a serene, dignified, and competent state, ready to perform an ultrasound-guided central line placement with the highest level of skill and compassion. Consent has already been obtained. During these moments, you will experience doing the procedure with a soft focus. Without trying to focus too hard on every detail. Effortlessly, retrieve your ultrasound machine and bring it into the room. Visualize yourself skillfully positioning your patient with gentle yet decisive maneuvers. The patient's head now sits in close proximity to your belly button. Rotate the patient's neck to one side. Position the ultrasound machine in direct line of sight. Optimize the settings, depth, and gain. Now with the ultrasound probe in one hand, identify the target vein. Notice how it easily compresses along its length. Observe how this gentle pressure enhances the pulsatility of the medially located carotid artery. And feel a sense of satisfaction as you identified a good target. Now, leave a small amount of gel on the probe tip. This is to help your future self when you're placing the probe cover. Place a table or a Mayo stand next to your dominant hand in a trash can nearby for quick and efficient disposal of anything that is not necessary. Seamlessly on one trip, gather everything you'll need: the correct central line kit and other essential materials, chlorhexidine, correctly sized sterile gloves, gowns, ultrasound probe cover, etc. And arrange these items on your table. Don a hairnet, mask, eye shield, and begin by thoroughly washing your hands. And while doing so, take a few centering breaths. Allow yourself to sense the soothing sensation of the cold water as it flows through your skin. Now, using chlorhexidine, carefully and thoroughly scrub the area on the neck, moving from the jawline down to the clavicle for at least 30 seconds. Open your central line kit on the table, ensuring that sterility is maintained. Follow the designated order of unwrapping, keeping everything sterile. Lay out the ultrasound probe cover, any other necessary items that you brought, and with meticulous care, you're going to drop those items into the sterile field. Put on your gown. Make sure you keep your hands inside the gown as you skillfully don your gloves. Your team is always there to help you if you need them. Drape your patient following the prompts of the drape, and as you do so, stabilize the drape over the target in the neck so it doesn't move. You can clean the area in the neck once more after you're done draping. Place ultrasound probe cover on the probe and make sure that there's a tight seal between the probe cover and the probe tip using the elastics. With a sterile flush, flush each lumen of the central line, ensuring there are no obstructions, and attach needle-less hubs to all ports except for the brown one. This is the distal port, and this is where your guide wire will exit. Do prepare a sterile flush with the needle-less hub that will be attached to the brown port at the very end of the procedure. This is just to help your future self. Now prep your guide wire for use by straightening the J-tip, and prep your needle and syringe by making sure nothing is too tight or too loose, as well as by testing the plunger. Visualize your materials in the precise order in which you will use them. Needle with syringe, guide wire, scalpel, dilator, gauze, central line. Needle with syringe, guide wire, scalpel, dilator, gauze, central line. Draw up lidocaine and then switch to the finest needle available, typically a 25 gauge. Using ultrasound, make a wheel of lidocaine at your target entry site. Now switch to a longer needle and inject lidocaine under ultrasound guidance just on the external wall of the vein. Place the guide wire close to your target where you can see it. While holding the probe with your non-dominant hand and the needle and syringe with your dominant hand, take a moment to appreciate the weight and texture of each item. Inhale deeply to center yourself, and then, with a steady hand, utilize the ultrasound image for precise needle navigation. As you enter the vein, pull back on the plunger. Blood flashes back into the syringe. Carefully release the ultrasound probe, and, using a pincer grasp, in your free non-dominant hand, steadily hold the needle shaft close to the skin. Use your hypothenar eminence and the rest of your fingers to provide stability to the needle. Non-pulsatile dark blood flows out of the hub. Introduce the J-tip of the guide wire through the needle. Ask the team to let you know if there's any sign of ectopy. There is no need to insert the wire further than the 30 centimeter marks. Once the wire is in, remove the needle while maintaining control of the wire, and confirm the placement of the wire inside the vein using ultrasound. Ask your team to help you capture the image. Now make a small superficial incision using the scalpel blade. Don't worry, it is very hard to cut the wire with the scalpel. And next, advance the dilator over the guide wire, ensuring it progresses 1 to 2 centimeters. Have gauze handy to keep things tidy. Advance the central line over the wire in a rotating motion, aiming towards the patient's heart. Remove the guide wire and occlude the brown port with your finger. Now connect the flush that you had prepared with the needleless hub, remember? And use it for the brown port. Ensure you obtain blood return from all ports and flush until there is no visible blood in the tubing. Everything is tidy and dry. Secure the line in place and place sterile dressing. Remember to confirm the placement of your central line with an X-ray or using subcostal ultrasound view as you inject saline, looking for bubbles going into the right side of the heart. As we come to the end of this visualization, take a moment to appreciate your skill and dedication to patient care. Carry this competent energy with you as you approach the task. If you notice that any step didn't proceed smoothly, such as putting on your sterile gloves while keeping your hands inside the sterile gown, or placing the ultrasound probe cover, don't hesitate to ask for precise feedback from your mentors, and visualize the drills that will help you improve. Thank you.